Hello you! Welcome to Hospital Psychology in Practice. Today we are going to talk about breastfeeding and weaning. Breastfeeding promotes the development of the baby's body and the subjective structuring of the baby's mind. The World Health Organization recommends that breast milk should be the baby's exclusive food for the first 6 months of life, disapproving of the offer of water, tears, and dummies, so that there is no risk of the baby leaving the breast. The breast not only nourishes the child, it also soothes the baby's anguish. During breastfeeding, the baby tends to seek out the mother's eyes, strengthening the bond and also seek psychic nourishment. So the mother should talk to the baby while you look at him, which is why you shouldn't use a cloth to cover the baby's face, nor should you use a mobile phone. In the same way, if a bottle replaces the breast. In the maternity world, all professionals must understand that there are psychological issues in the mother that can favor or disfavor the practice of breastfeeding. The mother's emotional state can interfere with milk production, according to Winnicott, a noted pediatrician and psychoanalyst. The mother should not feel that breastfeeding is an obligation, an order, because it can cause emotional damage to the mother and especially to the baby. So it's better to use a bottle. Therefore, if the mother doesn't feel comfortable with breastfeeding, the most important thing in psychological terms is not the breast, but the physical intimacy of holding and handling the baby. It's normal for breastfeeding to produce ambivalent fantasies and feelings, fear of being devoured by the baby, of feeling sucked in and enslaved by the task, but also feelings of satisfaction, pleasure, and love. The mother should not feel solely responsible for the baby's survival, nor the sole interpreter of its needs. It's important to share this task with someone so that the baby can enter the world and expand its emotional relationships beyond the mother. Weaning can't be early or late because it will damage the baby's subjectivity and psychological development for life. Weaning is a natural process for both mother and child if the connection and the pleasure of breastfeeding between baby and the mother no longer exists. In other words, the fusion has broken down. It's time to wean, and the pleasure between the two will now be mediated by language, by the mother's loving speech, the baby's laughter and sounds. At the next meeting, we will talk about the roles of women, wife and mother. See you then!